Welcome to the Advantage Home Care CDS training series. With CDS services, the consumer or client directs the hiring, training, supervision, and direction of the personal care attendant. These trainings are intended to give guidance to the attendant with regard to best practices. Let's get started. Today, we will discuss bathing services as an essential component of your client's care plan. Our goal is to ensure your client's comfort, safety, and well-being. With consumer-directed services, your client will direct their own care. However, this training is intended to offer you guidance through the bathing process. So let's dive in. Under your client's care plan, they may be authorized for bathing services. Bathing is a crucial aspect of maintaining personal hygiene and overall health. Your role as a caregiver is vital, as it involves caring for your client in a personal and intimate way. To start, let's focus on the sensitivity required when assisting with bathing, ensuring privacy, preserving dignity, and respecting your client's autonomy in determining their level of care. Understanding privacy concerns. Privacy is a fundamental right and should always be respected, especially during bathing and personal care routines. It is important you always knock and ask for permission before entering the client's bathroom or bedroom. You may need to get creative to help your client feel safe and protect their privacy. For example, if the bathroom does not have a locking door, you may need a privacy screen or curtain to provide a sense of privacy. Here, the caregiver is using a broom and a Swiffer to hold up a small blanket for privacy. If screens or curtains are unavailable or you are unable to come up with a creative solution, ask your client what would help them feel most comfortable during their bath. Close doors and curtains to block the view from windows or other rooms when possible. This will also help prevent unwanted drafts that will help ensure your client's comfort while bathing. You will also want to avoid unnecessary exposure by covering the person with a towel or blanket while moving them between rooms. Let's talk about preserving dignity. Dignity is about respecting your client's worth and value as a person, regardless of their circumstances. You can do several things to help preserve your client's dignity. First, it is important to communicate respectfully and listen attentively to their preferences and concerns. You should always use appropriate language and tone when communicating with your client. Avoid language that might be perceived as patronizing or demeaning. Allow your client to maintain as much independence as possible. Offer assistance as needed or requested, and allow their input on what assistance is needed. It is helpful to maintain eye contact and reassure them throughout the process to alleviate any feelings of embarrassment or vulnerability. Let's move on to empowering your client's autonomy. Empowering your client's autonomy involves recognizing that each individual has unique needs and preferences regarding personal care. In empowering autonomy, encourage the person to express their preferences regarding bathing routines, such as water temperature, choice of soap or personal care products, and their preferred level of assistance. It is important to respect their decisions about personal care, even if they differ from what you might consider ideal. Offer your client choices whenever possible, such as whether to bathe in the morning or evening, or whether to use a shower chair or bathtub. You must be flexible and adaptable to their changing needs and preferences over time. Now let's cover some practical tips for bathing. Gather all necessary supplies before beginning the bathing process to minimize interruptions. Check the water temperature to ensure it is safe and comfortable, neither too hot nor too cold. When bathing, start with less sensitive areas and gradually move to more sensitive areas to ease any discomfort or anxiety. Use gentle, supportive gestures when assisting with bathing and dressing to provide stability and reassurance. Be attentive to signs of discomfort or distress and adjust your approach accordingly. After bathing is complete, be sure to pat the client's skin dry. Do not rub their skin, as this can cause irritation or tearing to sensitive or thinning skin. Now let's discuss the different types of baths your client might need or prefer: the sponge bath, shower, and full body bath. First, there is the sponge bath. A sponge bath is when your client is not placed in water, but is cleaned with a wet, soapy sponge or washcloth. A sponge bath is a gentle and efficient way to freshen up without total immersion. A sponge bath is beneficial when a full bath isn't feasible or temporarily not recommended. During a sponge bath, you will provide hands-on assistance. Dry shampoo can be an excellent alternative to complete hair washing if a sponge bath is your only option. Next, we have the shower. If your client's care plan includes shower assistance, it's a fantastic option for a thorough and invigorating cleanse. A shower can be beneficial if mobility is a consideration. You would provide hands-on assistance during your client's shower, including washing their hair if needed or desired. And of course, there's the full body bath. A full body bath is where you assist your client in getting in and out of the tub and help perform a complete bathing experience. Using a pitcher or a large cup when washing your client's hair can be helpful. Just be sure to avoid getting soapy water in their eyes. A full tub bath can be essential for maintaining skin health and preventing infections. Tips for a seamless bathing experience. Now, let's discuss some tips to make the bathing process smoother for you and your client. Establish a routine. Consistency is key. Try to schedule bathing at a time that works best for your client, ensuring you are both prepared. Next, you will need to gather all supplies. Have all necessary items within reach: towels, soap, shampoo, and any assistive devices. Having supplies gathered minimizes interruptions and ensures a more comfortable experience. Be sure to adjust the room temperature. It is important to ensure the bathroom is warm enough to avoid discomfort. A warm bathroom is especially important for those sensitive to temperature changes. Communication is key. Encourage your client to clearly communicate their preferences and any concerns they may have. Open dialogue ensures that you and your client are on the same page, creating a more positive experience. Remember, providing home care services requires empathy, patience, and a deep respect for the individual's dignity and autonomy. Thank you for your commitment to caring for your client with compassion and respect. By approaching bathing and personal care with sensitivity and compassion, you can create a supportive environment that promotes their well-being and preserves their sense of self-worth and dignity. This concludes the Advantage Home Care Bathing Services training. We hope you found this information useful in your role as a CDS caregiver.